going to see tension headache. Tension headache is the most common cause of headache, and this is related to stress. So we have psychogenic, let's say, factors, and also the contraction of the scalp muscles. So this is the pathophysiology. Now the diagnosis is tension headache episodic type or chronic type. So usually the headache, wherever it doesn't matter if it is episodic or chronic, it lasts like 4 to 6 hours. Now, certainly more than 13 minutes. Now, if it is episodic, usually we would have less than 15 days per month, occurring less than 15 days per month, or less than 180 days per year. And in the chronic, we would have exactly the opposite: more than 15 days per month, or more than 180 days per year. Additionally, for the episodic, we need at least 2 of the following. The headache is fronto-occipital in location. There is no aggravation with physical activity. There is bilateral with moderate intensity headache. Moderate intensity. So very important that we bilateral. And the characteristic is pressure or tightness. So this is the classic characteristic: pressure, tightness around the frontal bone. So it is bilateral here, and this is related to stress. It's very common related to stress and lasts usually between 4 and 6 hours. This is the most common type of headache, and the treatment is with the abortive therapy would be just NSAIDs like ibuprofen or naproxen. And for prophylaxis, we could give tricyclic antidepressive drugs like amitriptyline or duloxetine. Now, when we're doing the diagnosis, always we need to rule out the temporal arteritis or giant cell arteritis if the patient has more than 50 years of age. So even though the patient has no constitutional symptoms, we would do a erythrocyte sedimentation rate to rule out the giant cell arterial or giant cell temporitis or vasculitis. So tension headache, most common headache, lasts 4 to 6 hours, is due to contraction of the muscles of the scalp, and the stress related, and the treatment are NSAIDs for abortive therapy, and for prevention, tricyclic antidepressive drugs.